Major changes on the way, of course, we've been telling you about when it comes to wearing masks outside, and we're talking about it tonight with Dr. Helen Boucher, Chief of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Good to see you.
Great to see you, Emily.
This is big. On Friday, the state no longer will require masks outside when distancing is possible. They do still need to be worn inside, and this applies to everyone. The CDC, though, only applying it to those who are fully vaccinated. So we want to ask you, what's the difference here? And are we certain there is low risk either way?
Yeah, it's a great question. So we know that being outside is orders of magnitude safer than being inside. The fresh air disperses the viral particles. It's easier for us to stay apart. We have weather on our side. Humidity and warmth send away the virus. So a lot of good factors. And then here in Massachusetts, our numbers are down. We're down 20% in the last month. So all of these have led the governor, by looking at the data, to make this recommendation that being outdoors when we can be separated, it's safe to take that mask off.
Yeah, you say look at the data, make these recommendations. Another one of these, the increase on limits for public gatherings. They'll allow more freedom at bars. By August 1st, it looks like these restrictions will be gone. Do you feel confident we can maintain that drop in cases, maintain a rise in vaccinations to get to that point in 3 months?
Well, I'm really hopeful, Emily. There's work to do. We really have to continue to keep the pedal down, to the gas for vaccination and keep adhering to the measures that we have. We have to go step by step and could keep following that data. But if we do, I really think we're going to continue to see good things.
You mentioned the vaccinations there. We've loosened up a bit before. We needed to roll back a little bit. What is different this time? Is it just the vaccines?
Well, it's probably a number of things, right? So we're very glad that the numbers are down, that the weather is getting better, that the vaccines are going up, and it's probably a combination of community immunity, right? People who've had the infection and are immune, vaccine-related immunity, and then some of these other factors that are coming together in a positive way now. It doesn't mean we have to stop being vigilant or stop paying attention to the data. We need to stick with it, but it is good news.
I want to ask you globally, this is your area of expertise. Talk about India. Roughly 350,000 new cases every day. That number is climbing. The healthcare system can't keep up. Is there a risk that what's happening there eventually changes the outlook for COVID here?
Well, what's happening in India is beyond heartbreaking. It is a wall of new infections, as you mentioned, numbers that are hard to comprehend. The healthcare system's overwhelmed and the deaths are absolutely devastating. The key to not letting that come here is for us to maintain our vigilance, to take things step by step, to keep up the public health measures and respond to the data. So it may mean, as you mentioned, that we have to step back. As we open, we may have to take 2 steps forward and 1 step back. We just cannot get too far away from the data because this virus will find any opportunity it can. It's just a virus. And, if we continue to stay true to these measures, I think we will continue to see good things, but we have to do our best to help our neighbors around the world and pay attention and learn from their lessons.
And we know that you and your colleagues are watching it. Dr. Boucher, thank you so much for your insight, your time. We really appreciate it.
Thank you.